final word for parents who have concerns where their child is having some sort of issues in normal development. What can we tell to such parents, Sharon? Should they wait for the child's pediatrician to refer them, or should they go and see a speech pathologist, or should they get the child's hearing tested first? Who should they be seeing first?
Hello everyone, my name is Reenu. Currently I'm practicing as an audiologist. Today I thought I'll discuss to you about why it is important to identify speech and language delays at an early stage in kids. So there are mainly 3 to 4 reasons why it is important to identify and give treatment for speech and language delays in kids. So the number one reason is the brain development in kids. It's happening at a very fast pace during the first few years of life. So when a rapidly developing brain is exposed to a new language, the brain is in a much better position to learn the new language, isn't it? The second reason why, when you compare a child's brain to an adult's brain, the child's brain is in a much better position to learn a foreign language. For example, we as Indians, we have an Indian accent even when we talk in English, right? Whereas an Indian child, if he or she is born and brought up in an English-speaking country, the child will not develop an Indian accent but will start to talk like an English-speaking person. Whereas it is much difficult for an adult who has already completed the language acquisition to learn the foreign accent and the language per se. The third reason why. Behavioral issues are very common in children with speech and language delays. It'll be much easier for the parents to address one issue rather than multiple issues, right? Now the last reason. Academic performance is also affected in children with speech and language delays. So, in all these perspectives, the earlier you detect and provide treatment for speech and language delays, the better the child's development is going to be. Today I've got Sharon with me. Sharon is a practicing speech pathologist based in Kerala, India. I'll introduce Sharon to you guys. Sharon actually has got a master's degree in speech pathology. She's graduated from Mysore, All India Institute of Speech and Hearing. She's also completed her bachelor's degree in speech sciences from ISH, Bangalore. Welcome, Sharon. What are we going to discuss today?
Thank you, Reenu. Thank you for inviting me. So today we will be focusing on speech and language development in young children, starting from newborns to 12 months, that is newborns to 1 year of age. Other components of development that influence speech and language development and has close connections with speech and language development. So we will be discussing them as well, which includes social development, cognitive development, play development, and emotional development. Along with that, Reenu will also be giving pointers regarding development of hearing. So all of these linked together to speech and language development. So we will be discussing all these in newborns to 12 months of age.
Okay, just before we start, for those who don't understand what is cognitive development, can we just explain that a little bit?
By cognitive development, we are referring to the development of, let's say it is tied closely to the development of brain. We'll be looking at the development of things like intelligence, thinking, reasoning, problem solving. Now it will be surprising if you think that, do children as young as newborns do these things? Yes, children do use all of these cognitive skills when they interact with other people, when they are playing. They are bringing all of these skills into it. So By looking at those behaviors, we can make some assumptions regarding the cognitive development of children. So that is what we mean by cognitive development in children.
Okay, thanks for explaining that, Sharon. Okay, so when a newborn child is born, everyone is excited and very happy. A lot of times they're aware of how the child should be growing physically, when the child should attain neck control, when the child should start walking. When it comes to speech development, a lot of parents and grandparents are not very sure. So that's what we are going to guide you guys with today. This is only an informative video. We cannot discuss everything in fine details. So please take this only as a guidance. So let's get started. The child is born. What can we expect in terms of speech, language, developmental stages?
6 months. These first 6 months, it is like we will think again. We will be wondering what is there to observe in a child as young as a newborn. So, like I said earlier, there are two groups of behaviors that we need to be looking at. The first group of behavior will include social, emotional, and play development, which, for the sake of convenience, we are discussing together. And the second group of behaviors will include speech and language development. So, in social, emotional, and play development, what to expect in the first 6 months? The earliest set of behaviors that needs to be looked at are called social engagement behaviors. So we all know the child have been in the womb up till now, and when they are born, they are suddenly introduced to this world of people. There are people around him or her. So we need to look at whether the child is making efforts to relate to the people around the child. That is called as social engagement behaviors. The earliest forms of social engagement behaviors are being able to calm down when somebody is picking the child up. The child is crying, and if somebody picks the child up, or if somebody comes and talks to the child, if the child is able to calm down, or if you see that the child is calming down, then that indicates that the child has some amount of primitive social engagement behaviors. Another indication for social engagement behavior is the child will orient themselves to people who are walking into the room. Child will pay attention when the mother enters the room or when the mother moves around in the room. So we know a child as young as a newborn doesn't have a lot of motor skills to move his head and look at the mother, but we can still see that the child uses his eye tracking abilities in order to keep track of where the mother is moving. So watching people move in the room, orienting themselves to people who come into the room is another early social engagement behavior that we can look for. Also, we will see that many young children in the first 3 months, they make sounds in order to try and get the attention of the parent. Or if they don't make noises themselves, they will use some object in the vicinity to move it or kick it, put it down and use that noise in order to attract the attention of the parents. Yeah, rattles. Yeah, shake it. Rattles is something that we give to these young children. So yeah, it correlates with the development of the social engagement behaviors. Very young children, their visual skills are not completely developed. When in a newborn, the visual skills are not completely developed. It is in the process of development in the first 6 months. By the time the child is 6 months of age, their visual development would have completed, and at this time, they would start recognizing familiar people. So they have not actively they learned to discriminate between a stranger and their significant people, but they will start understanding that this person is familiar to me. So that is also a behavior that you will expect in the social, emotional, and play development arena. These are the behaviors that you expect in the first 6 months.
Okay, so the child should be engaging with the primary caretaker. That can be a mom or a dad or a grandparent. The child should be relating to the parents or the immediate caretakers. In terms of engaging behaviors, what we notice is calming down when the mother is picking up the child, or an attempt of stopping crying when the mom is nearby or when the mom picks up the child. Also, the child makes attention-seeking behaviors in the form of making sounds or moving objects in the immediate vicinity of the child. And even though the child's eyesight is not fully developed, the child almost by 3 months of age, it starts to recognize his or her primary caretaker. Is that right?
Yeah, by 6 months, actually, by 6 months, they start recognizing, they start showing a kind of a preference between familiar people and strangers. So,
yes.
6 months.
Okay. All right. So, as Sharon was saying, the eyesight is not fully developed when a newborn child is born. So, how about hearing? In fact, the hearing is fully developed when a child is born. By the time the child is 20 weeks in the mom's womb, all of the structures actually start to develop. And by 25 weeks of gestation, the hearing is actually fully developed. And that's the reason why when a child is born, within the first 2 or 3 days, in the hospitals, they'll come and test the child's hearing. And they'll be able to tell us if there is any concerns or if there is normal hearing presence or absence. So that's about how the child's hearing is when he or she is born. So there are behaviors we can observe in a child, and we can assume whether the child's hearing is normal or not. Even a newborn child will have reflex behaviors in response to loud sounds. So what we mean by reflex behaviors is the child will cry in response to a loud sound, or the child will have a startle reflex, like the child will get a startle, blinking eyes, moving his arms and legs outward. That's another reflex behavior. So these can be observed in a child, even a newborn baby. So when a child is being fed, if the mom is nursing the baby, and if there is a loud sound in the same room, the mom should be expecting the child to be crying or getting awakened from the sleep. So if the child is still peacefully sleeping and drinking milk, the mom should be thinking why he or she did not wake up, right? Now, by the time the child is 3 months of age, we know the child attains neck control, right? So even before the child attains neck control, the child is actually capable of looking with eye movements in the direction of the primary caretaker's voices. That can be the mom's voice, or that can be the mom's footsteps, or some familiar voices in the room. The child will be turning the eyes in the direction of familiar voices. After 3 months of age, the child should be turning his or her neck in the direction of sounds where it is coming from. Now later we know that children start making sounds, they start imitating the sounds they're being told, right? So this happens only if a child has normal hearing. And we know that children with hearing deficits, they're at a higher risk of having delay in speech and language development. Now, that brings us to speech development in kids. So Sharon will be discussing how the speech and language development should be in a child who is newborn till 6 months of age now.
For all their needs, the earliest form of communication is crying itself. So in newborns, if you are looking at speech behaviors, what speech behavior are we looking at? We are looking only for crying. But as the child moves through his or her development, she achieves something called as a differential cry. A differential cry is a variation in cry that the child makes in order to express differences in their needs. So by the time the child is around 3 months of age, the child will be able to, again, indicating using crying itself, but the child is now varying his or her cry in order to indicate the differences in needs. So there will be a cry for hunger, there will be a cry for pain, there will be a cry for sleepiness. Not everything, we are not talking about expressing everything using crying, but for the very basic set of needs, the child does have differential cry, which the immediate caretaker can understand. So you would have seen grandparents or parents who say, when they listen to the child cry, they say, oh, it looks like the child is sleepy, it looks like she's hungry, or it looks like the child is in pain. So by about 3 months, we are expecting differential cry to be present in a child. And after differential cry, the child will move on to something called as a vocal play. So we are looking for 3 different groups of sounds in children between 0 to 6 months. The first group of sounds are called as cooing sounds, which are produced by using the back of the child's oral cavity, mostly the throat. So the sounds will be something like an oo or a ah, not the typical oo and the ah that we use, that adults use during speech, but this is more shaping their vocal cavity in order to produce sounds that we hear as oo or ah. So those sounds are called as cooing sounds. The second group of sounds are called as raspberries, which are again produced using the lips and the tongue, which sound something like. So the child is actually playing with different parts of his or her oral cavity in producing these sounds. And the third group of sounds are called as squealing sounds, which sound something like. The child keep on making those sounds as an act of vocal play. So like Renu said, this child is hearing her caretakers, people around him or her talk to them, and the child is for a hearing child, the child is now imitating those sounds that they had heard in their environment. And when the child imitates these sounds, the child is getting a lot of feedback in terms of hearing as well as the senses that the child is experiencing from his oral cavity. Again, also from visual feedback that he gets from his people around his or her environment. So using all of these feedback, the child is able to create a motor plan inside the child's brain, which the child can use in future in order to produce variety of sounds. I am not saying that the child is creating that entire motor plan the moment they start using vocal play. It is not like that, but the process has begun when the child starts vocal play. And by about 6 months, as the child's motor skills are improving, the child will start using sounds, consonants that sound more like the ones that we use in adult speech. So that we are going to call it as babbling. It sounds like ba ba ba, da da da. By 6 months, babbling emerges.
Okay, so the early form of communication is mainly crying. We all know that. The child comes to this world with a cry. Everyone is with a cry coming to this world. And thereafter, we have something called differential cry, where the child is trying to communicate his or her basic needs through different patterns of crying. So there is something very important there. Even though the child is not able to talk, the child is communicating through a cry. And the child's needs are being met through that cry. So later, so the child is 3 months of age or something, the child starts developing more sounds using the back of the throat. Ah, oh, sounds like it's mainly like the child is trying to play with different sounds, not like the typical ah or oh that we say. And then mainly using other structures. So from the back of the throat, later as they develop, they use more structures in the mouth, using lips, the tongue, all of that. And by the time the child is 6 months, the child starts using sounds which are called as babbling, which we'll discuss more in detail in the next step. Okay. All right, so we've come to 6 months. The child has attained neck control. The child has turned over. So the child has achieved 2 major milestones Now we're going to discuss more about speech and language development after the child is 6 months of age.
Again, we are going to talk about developmental progressions in two groups: social, emotional, and play development. So if we are looking at social, emotional, and play development in a child who has crossed 6 months, I said earlier that the child's visual development has been completed by around 6 months. The child can differentiate between strangers and familiar people. So, in association with that, the child will start developing behaviors that indicate preference of significant people, significant others in his or her family. So, the child will start showing shyness, or become clingy to his immediate caretakers, or will start showing fear when a stranger approaches them. So those behaviors can be observed after 6 months of age. Another thing is facial expressions. The repertoire of facial expressions will start to widen. So earlier, what we have is a short chuckle, a small smile that we can elicit if we happen to do something that the child likes. But after 6 months, it will start widening. So the child will express emotions like sadness, anger, and even surprise. Using their facial expressions, the child will be able to express all of these behaviors. Another behavior that is a social behavior but also has speech and language associations is a name call response. So we are not, we are not focusing only, or we're not talking only about their official name. It could be a nickname, something that they use in the family in order to refer to the child. So the child, when that name is called, the child will show some behavior that lets us know that the child orients themselves to that name call. So name call response is something that emerges after 6 months. So child might look at you when you call them, or if you tell their name, they will stop their activity and focus on whoever is saying their name. So such behaviors can be observed after 6 months. Two other cognitive skills that emerges after 6 months, around the age of 1 year, that would be the more correct way of saying it, are joint attention and object permanence. Joint attention is the ability to attend to a common object along with their caretaker. So it could be a game, or it could be a book that the mother is showing the child, or it could be the mother has taken the child outside and is showing them something. So it could be anything that the parent is trying to show to the child, or the child has found something interesting and the parent has joined them. So in either case, if they can share their attention, that would be referred to as joint attention. So again, we are not saying that joint attention is completely developed at this stage, but the beginnings of joint attention is what we are observing at this stage, when the child start playing games like peekaboo or pat a cake. For Indian parents, it would be something like Olichekande, or there are Urumburumba, Apponchutta. There are a lot of games that the mother and the child, or this caretakers and the child, engage in around this stage. You will see behaviors like an anticipation for the game. If the mother says, okay, let's play peekaboo, the child anticipates that game. If the mother has used a veil, pull it down, or ask for more game using indications that ask for more of the game, laughs along with the mother during the game. So all of those behaviors indicates that the child is developing joint attention. And in the beginning, the span of this attention might be lesser, and as the child grows older, as he or she progresses through the development, the span of attention increases as well. The second behavior that we are expecting at this stage is called as object permanence. Object permanence is the knowledge that an object that has moved out of his or her eyesight still exists. So if there was a ball that was in front of the child and it has rolled under the bed or the sofa, the child is expected to look for it. A child in this age is expected to look for it. Again, it is associated with other behaviors, like if the mother moves out of the room, the child cries in order to bring her back. So all of these behaviors indicate that the child is developing object permanence. So these are the behaviors, social, emotional, and play behaviors that we are expecting in a child between 6 months and 12 months of age.
Okay, so just to summarize, by the time the child is 6 months of age, the child sort of develops more preference towards parents or primary caretakers. With strangers, they start to exhibit being more shy, or they have a fear factor towards strangers. So that's like being shy or having more preference towards familiar or family members. And when it comes to expressions, now the child is not just crying, the child expresses different emotions with their facial expressions. Sadness, that was always there through crying, but now it's more than that. Surprise, happiness, all of that, anger, all of that can be seen as an expression on the child's face. And responding to his or her name is expected during this early stage itself. So it's not normal for a 2 or 3-year-old child not to respond when his or her name is being called. So the child should have name call response at an early stage as 6 months to 12 months of age. And later, when the child is engaging in play activities, the child should be exhibiting joint attention. So that is the mom and the child engaging in the same activity, focusing on one activity together, playing together. And the last thing we discussed was object permanence, and that's really important when it comes to language acquisition. The child should be able to maintain his focus on one task or on one object. Let's say the child was playing with the ball and the ball went rolling under the bed, and the child goes into another activity, and without even remembering what he was doing before, the child going from one activity to another and then to another, it's not a normal behavior. That is clearly telling us the child does not have object permanence. And it's really a very important pre-linguistic skill that we look for when children come to us for speech and language assessment. All right, so that's about social and emotional development. Now we're going to speech and language development from 6 months to 12 months of age.
When we were talking about speech and language development in children younger than 6 months, we said they start developing babbling by around 6 months. So babbling refers to repetitively producing consonant vowel combinations. So we have baba, baba, da, 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 papa, papa. Children begin babbling by using this same sound combinations, repetitively producing the same sound combinations. And as they progresses in their development, they start producing different sounds in the same repetition. So that would sound something like ma ba 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 or da pa 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 pa. Different combinations. Again, this is an extension of the vocal play that they have started under 6 months. So they are experimenting with different sounds and different sound combinations. And again, this is called as variegated babbling. After variegated babbling, as the child progresses through development, they also exhibit something called as a jargon stage. This jargon stage of speaking is more like imitating their parents or imitating the speaking style of people around them. So they see adults talking a lot, so child also imitates the activity of talking. So they don't have real words yet, so that is why we are hearing it as jargon, but they do act like they are talking, they are speaking, or they are when they are playing, they keep on saying things. So we have a lot of parents who say, they talk what things that doesn't make any sense to us. So that is the jargon stage. So if you have a child like that, it means he or she is in the jargon stage of speaking. And moving from jargon stage, they around the 1 year mark, they have to say their first word. So we have very early first worders who say their first word around 9 months of age, and then you have children who say it at around 1 year 3 months. So it's a wide range, anywhere within this range, the child has to say their first word. By first word, we are referring to a word that the child uses in order to refer to one particular object. So it could be something like mama, dada, kaka, which is a crow. The translation of crow in Malayalam is kaka. So these are the words that are commonly used by children. And the child will use this particular word in order to refer to its referent. So mama is used to refer to his or her mother, or dada is used to refer to his or her father. The child might use the same word in order to refer to other people also. Mama might be used to refer father and grandmother also, but for mother, the child is going to always use mama itself. That is what demarcates the first word. So there is a referent word association. Child is showing an indication of referent word association, and this emerges around 9 months to 1 year, 3 months.
All right. Yes, go on.
Also, with respect to the language development, now whatever we were talking about, those were speech acts. With reference to language development, what the child understands at this stage, the child would be able to follow simple instructions like give, say bye, or stop. Stop and no is something that children acquire quite early. So if the mother says stop, if the mother says no, the child will be able to understand that. They will not necessarily stop the activity, but they will pay attention when the mother says no. Simple instructions like give or come, all of these can be common instructions that we use on a day-to-day basis, can be understood by the child at this age. Yeah, that is what to expect till 12 months.
Yes. So for those who are thinking it's okay for a child to start talking by 2 or 3 years of age, this is what we have to say. The first word should emerge by the time the child is 9 months, or up to 1 year, 3 months. That's the window we can wait for the first word utterance. And the first word utterance should be meaningful and consistently used to refer the same object. If it's mum, the child should be saying the word mum to call the mother. All right. So that brings us to 12 months of age. First word utterance we discussed. Sharon has to add one more thing.
Yeah. So when we were discussing all of these behaviors, these speech and language behaviors, social engagement behaviors, and even when Renu was talking about hearing, there's one very important factor that needs to be remembered, that with all of these behaviors, the child is exhibiting something called as a communicative intent. That the child has an affinity towards communicating with other human beings. So in a lot of children where this communicative intent is affected, it is really difficult for those children to achieve communication or interaction with people. So those children actually becomes socially isolated. Communicative intent, if we look at these developmental steps, we see that it actually begins as early as 3 months. So by about 6 months, we can clearly see whether the child has an affinity to people, or the child doesn't have an affinity to people, or doesn't have an intent to communicate. So it's a very important skill that needs to be considered.
Yes. And we being humans, we exchange information through speech and language, right? So that exchange of information is what we call as communication. Even when the child is not talking, the child is trying to communicate through different modes of crying and all right. So just about a final word for parents who have concerns or who are in a doubtful situation where their child is having some sort of issues in normal development. What can we tell to such parents, Sharon? Should they wait for the child's pediatrician to refer them, or should they go and see a speech pathologist, or should they get the child's hearing tested first? Who should they be seeing first? In my opinion, it doesn't matter who they see first. The person they are seeing should guide them in the right pathway, should be able to tell them where the child is in terms of his or her development. Okay, Sharon will discuss the rest of it and then we'll wind up today's session.
Yeah, no, it necessarily doesn't have to wait for the pediatrician. A lot of pediatricians are aware. They do take the child's development into consideration and they will give you the correct pointers. But if you don't get it, and if after seeing this video, or if after looking at something, if you, after reading, browsing through the web, you think that the child is lagging behind, or you see some behaviors are not present, then it would be nice to make sure that all these developmental stages have been well checked, or it has been looked at and has been communicated to you, not just them saying, oh, it's all right. It's not like that. They have to look at it, and then they should communicate it to you, saying, okay, this is what is expected at this age, and your child is showing it. Why? What is the reason? That is something that we tell parents who come to us. We do tell them, okay, there are parents who come to us who are concerned, but when we look at the developmental checklist, we see that the child is going on track. So when we find a child like that, we do tell them, see, there are certain behaviors that the child is not showing, but the child is also showing these behaviors, and all the other things contribute to us saying that the child is developing typically. So when you approach a professional, it would be better to see if they communicate this to you well, if they have told you why they are saying it is okay to wait, and if they are asking you to come for intervention, why they are asking you to come for intervention. In either cases, I am not just saying only about professionals asking you to wait. I'm also talking about people who ask you to come for intervention. If they have been able to tell you the reason why they are going forth with that decision. And also, it would be better if you go to a place where there are many rehabilitation professionals working together, because like I said earlier, development is not a unidimensional thing. There are many aspects to development. Now, while speech and language pathologist and audiologist will focus on speech, language, and hearing, and some aspects of social and emotional development, there is a wide arena of development that needs to be addressed at. Sometimes children have difficulty with sensory processing, sometimes sensory processing as in processing of touch and bodily senses. Then sometimes children have difficulties with cognitive development, not just the ones that comes within the premise of a speech and language pathologist. So it would be best if the child is seen by all the rehabilitation or many different rehabilitation professionals, and then they reach, a diagnosis or conclusion by communicating between each other. It's not something like an interdisciplinary or a multidisciplinary approach. And once the diagnosis have been made, then you can go on with the intervention as needed. But at least for a diagnosis purpose, at least for clarifying whether the child has a developmental lag or not, it would be best if you can meet or go to a place where there are many professionals working together. But like Renu said, if you are concerned and if somebody tells you wait, then yeah, it would be better if you take a second opinion if they haven't explained it to you convincingly, if they haven't convinced you with regards to why they said we can wait. Even when we say wait, and if we see that something is missing, we do ask them for follow-ups. We call them after 6 months in order to recheck that the child is still progressing well developmentally. So something that cannot be identified earlier might be identified later. So all of these things should happen if you have a concern.
All right. So like I said before, the sooner the better. It's a precious time that is being wasted when you wait and do nothing. So it's better to get the full picture rather than being vague and being in the dark. So see a speech pathologist. They'll be able to guide you the right way. If there is further professionals needed in the intervention of the child, they would guide you the right way. So today we have come to the end of the discussion. Thanks for joining me, Sharon. We'll be back in the next session discussing from 1 year to 4 years of age. All right, everyone. Thanks for joining us. Thank you for joining me, Sharon.
Bye, Renu.